All right, we're now on post 3 of the user interface order entry design. The first post looked at some general requirements for medication order entry. The second post looked at examples of order entry and order sentences. And this third post, we're going to give it sort of a simple heuristic or being able to divide order entry into two large categories: order selection and order customization. This post doesn't have any particular graphics, so you can just listen to the audio. When looking at order selection or drug selection, I think there's a lot of different ways that this can happen. Whereas when we look at order customization, I actually think just a single tool is required. And let's just go into this in a bit of detail. When you look at order selection or drug selection, there's a lot of different tools that could be designed. You might have tools to assist a clinician in selecting an order, such as a favorites list, the ability to search by name, the use of order sentences, clinical decision guided selection, computer suggested orders, etc. And we'll look into this actually in much more detail in the next post. There's also a lot of different places in the electronic record where an order interface could be placed. It could either be a discrete button somewhere on the screen that launches a whole separate order entry window. It could be a button which is the whole order itself that's embedded directly into a clinical form or a note. And when you combine the different types of tools that could be designed and the different types of places order entry panels could be embedded into the EHR, you end up with high variability. And I think this is the takeaway that's important, is that order selection by nature is going to result in high variability of the different types of designs and tools that can originate. This is in contrast to order customization. Order customization is the step or the page or the panel where you see all the different potential variables that can be adjusted for that particular item. So for a medication, for instance, you might be able to change its name, dose, frequency, route, duration, priority, special patient or nursing instructions, special compounding details, start date, stop date. The list goes on. And if you're, for instance, placing an order for an imaging request, again, there's a whole long list of variables which you could potentially change: the imaging modality, the body part, the reason, the indication, the suspected findings, the contraindications, the pregnancy status, patient weight. Again, the list goes on. And when you think about getting to this step of order customization, there's different ways which we're going to get to the order customization step. For instance, the user might be looking at a list of active medications and select a button which says Edit Medication Details. Or at other times, the user might be in the order selection tools, and that tool isn't sufficiently granular to complete the order, and therefore it takes the user to the order customization panel or step. And it's important to realize, though, that the order selection tool, if it's done properly, and it allows the user to quickly and accurately pick the specific order they require, they actually can bypass the order customization page entirely if the user is able, back in order selection, to select a complete order. And this is really important because ultimately we want to avoid the order customization page as much as possible. It's a highly unpleasant part of the EHR. As we've been discussing, there are just too many fields that can be adjusted, and adjusting them is slow. It doesn't work great on mobile, and it's best to stay away from this part of the EHR. But if one does have to get to the order customization step, regardless of how they got there, the actual interface that they need, which is essentially a long list of variables, is pretty much the same. Now, obviously, as we mentioned, the variables that are required will depend on the actual order type. A medication will need different variables than an imaging request versus a lab order. But within each of these larger categories, there's minimal variation. And so the big takeaway is that when you get to order customization, this can be done with a single tool and user interface. But when you're looking at order selection, by nature, we're going to have a lot of different types of tools and places where they can be embedded. All right, why is this important? Well, in general, we're trying to simplify the electronic health record user experience wherever possible. But there are some places where variation will be required, and I think we've discussed that in this post. Now, as I've said, I think we can have a single order customization tool. But the thing which is important to realize is I don't think we really have any clue what the optimal design for this is. And so significant research and debate needs to go into what is the optimal order customization tool, what works great across mobile, tablet, and desktop. And we might find in the end that there's perhaps 3 or 4 or several different order customization tools which perform equally well in clinical testing. And in that case, it would come down to there's probably would be a default set for the EHR, and if the user wanted, they could go and change their default. Similar to how a user has a default keyboard on their phone, but they may want to change their default keyboard. In general, most users don't switch between multiple keyboards throughout the day, although some may do. In general, if you don't like the default, you switch to a different default, and then you use your new selected keyboard. And I think order customization is the same principle, but order selection is an entirely different ballgame. And so the next post will be looking at trying to think from first principles why we place orders into the computer and how this translates into different types of order selection tools.